we have to be bold because people are just getting unhealthy.
Yeah. So, as they're emerging healthcare leaders, what advice would you give them then to make this impact? As you mentioned, we're spending more but still getting unhealthier. So, how do we
Yeah.
bring those together? How do we improve healthcare equity or patient outcomes? Um,
I think there's two pieces of advice I would give. The first is, remember that your role is to focus on the patient.
mhm,
I used to always say patient first, physician or provider second. But or they're the same in some situations. But if you're not focusing on why you're there in the first place, you already lost. And so
mhm,
that's the first thing. The second thing is to not be afraid to rethink old norms. If you do things just because you always did them that way, why?
right.
Like we used to, I mean, we made patients come in during banker hours and wait a half an hour to an hour to sometimes 2 hours for us. And then we didn't see them when they were 10 minutes late, right? How does that make any sense? So I
Mhm,
would say that be willing to, as a healthcare leader, be willing to rethink and just pressure test why you would have to do something a certain way. Just because someone did it that way in the past doesn't mean it's the right way to do it.
yeah. So it's part of growing and adapting. Just keep asking why, and
Yeah.
so you can make something better.